Hi, I'm Steve, and this is 4Minds. But you have to have a combination of the dissociative disorders and the symptoms that come along with it. Um, they will check for if you've had childhood trauma or abuse. They will refer to your counsellor or therapist. That's about what you've talked about. To see if you've said anything about your. They will also see if you've reported any blank spells, basically memory relapses, to see if you've forgotten part of your day. They will also see if you hear voices, which is one of the most common symptoms of dissociation, usually with DID. And the voices can be your alters or your other personalities inside your head, or thoughts intruding into your head, and also intrusive thoughts, which is it's basically your own voice, it's your own thoughts, and they end up telling you to do something or saying something. Like, you could be sat there watching TV and your voice in your head will be telling you to say smash up the TV, when that is an intrusive thought. That is not your own thought process. And you have to have thought or to have borderline personality disorder to get diagnosed with dissociation. And you will most likely have passed unsuccessful treatment for whatever disorder they think you might have, or if you've been given medication for depression and that hasn't worked. And usually self-destructive behaviour as well. Kind of like either self-harming or going on a rampage. It usually ends up affecting yourself rather than others. And finally, a no thought disorder. And a quick fact for you, people aged between 20 and 40 are usually diagnosed with dissociation, with a higher rate of women being diagnosed than men. Okay, there is quite a lot of difficulty in diagnosing dissociation, which usually leads to insufficient training for either GPs or therapists or whoever's diagnosing you or giving you medication. And quite oftenly, you will get misdiagnosed before actually getting diagnosed with dissociation. But one of the things is, as well, is GPs don't normally ask about your childhood. You could spill out about your memory relapses, people saying you've acted differently in certain times, but 9 times out of 10 they will not ask you about your childhood, which is an important factor. And finally, it is really hard for some people to tell about your alters or other personalities, because you could go see your GP, but it's not like one of your alters is just going to appear in the middle of a meeting. Okay, some important tips. Do not self-diagnose. If you think you may have dissociation or DID, then you need to go see your GP and explain to them you think you may have it, and pretty much tell them everything, what goes on a normal day, tell them about your memory relapses, and tell them about the voices you hear. Try and tell them about your childhood. That's one of the reasons that you need to tell them to get a proper diagnosis. It's so that your GP can properly refer you to the right therapist or psychiatrist. You have to self-help, which basically you have to try and find connections between your other personalities, your alters, your feelings, your thoughts, and trying your best as you can to connect them together. And it sounds a lot more complicated than it is, which I will go over in a different video of how to do this. But it's basically finding out the triggers as well, like why does this personality come out at this time, what was I doing then, and that's basically the triggers. Doing all this will hopefully help you either overcome the disassociation, or at least help you manage the voices and the alters coming out better. Since dissociation comes along with memory relapses or amnesia, it's best to bring someone you trust with you to an appointment or a meeting or a session. So because you might forget what happens in that session, or when they schedule a new appointment, you might not remember it. So that person can be like a note taker for you. It'll also be helpful to bring along an advocate if you need to, because they're going to be talking for you and listening for you, so you don't really have to. There isn't really a lot of treatments for dissociation. It's usually just talking therapy, trying to break down your personality and your other personalities, to figure out what the connections are, how similar we all are, and trying to work through past experiences, primarily your childhood. Because as I've come to learn, it didn't state it in my sources, but it's basically PTSD, post-traumatic stress disorder. But there are a combination of methods. There aren't a lot, it's mainly just talking, like I said. But one of them is EMDR, which is basically hypnotherapy. I've done a little bit of this, and it's basically you close your eyes, your therapist or psychiatrist will make you think of a safe place, and you've got to keep thinking that safe place over and over and over again. And it might be triggered with a keyword or an action. And then your therapist might say something like, okay, think about your first memory. Think about your childhood. Who was your safe place when you were a child? And that should spark some memories. And then if you start either getting frightened, scared or anxious, you can instantly be like, okay, keyword, and you'll go back to your safe place. And with the self-help part, the therapist or psychiatrist will probably give you homework to do. It completely depends where you are in your sessions. Like for me at the moment, it's trying to identify the triggers. And now on to medication. There is no cure or medication for dissociation. There is just treatments for the symptoms like depression and anxiety. But if you were to receive medication, it has to be the dominant personality that's suffering these things. Like, for example, I suffer with depression, so I have to be given the antidepressants. But say if one of my alters has depression but I don't, then I cannot get antidepressants because it's not the dominant personality suffering with. And now onto the last section of today's video. It's basically about crisis. Like, there is the crisis team, Samaritans, and a bunch of others that if you need help you can ring them, and they will talk you through whatever you're going through. Like, if you're feeling suicidal, then they can help talk you down, because not everyone wants to commit suicide, but they do feel like they either need to or they think about doing it. So it's best to make like a crisis plan, which you can ask your therapist to help you write this, and it'll basically be saying what happens if you, in case of a crisis, if you are unable to make decisions for yourself. Like, say one of your alters takes over and doesn't let you, the dominant personality, come back out, and they go off and try and make a new life, then whoever's in charge, like a doctor or your therapist, can technically get you temporarily sectioned and to give you either the right medication or whatever you need. And this is because of the Mental Health Act in 1983. But like, as I was talking about my triggers, I kind of have to keep a journal of when I've either disassociated or when my alters have came out, and I've got to try and break down why that happened, when it happened, including trying to get your alters to write in your journal as well. You may realise that your alters have a different handwriting to you as well. As I was talking about EMDR briefly, it's basically a technique called visualization, and you can do this on your own. You do not need a therapist there. It's just trying to gain the skills to think about your safe place and be able to go there just by clicking your fingers or saying your keyword, and you'll immediately envision your safe place. And finally, depending on your severity, but I would recommend anyone with dissociation do this. You need structure and routine in your life. Do the same set of routines every day. Like, as soon as you get up, have your breakfast, have your cup of tea, then do like the pots and the dishes, then make food, go to work, and then come home and do the next set of routines. Don't just sit there. Try and figure out something to do to keep that structure in your life. And it is completely possible to make a full recovery, not to have any dissociative states other than the natural ones, to basically get rid of your alters and to stop hearing the voices as well. But not everyone recovers fully just like that. It's going to be more like you manage it better. That is a more realistic goal. And finally, this is for people who don't suffer with dissociation, just like your friends and your family. Just so you know that a person with the disorder doesn't know how they need help. They might have some idea but not always, so you need to be patient with them. Try and help them with certain tasks if they require it. Keep an eye out for when they're shifting into a different alter. Respect their boundaries, because it might not be the same personality you're used to. Like you're used to, say, hugging the dominant personality, but the other personality may not like that. So you need to respect the boundaries, ask them if it's okay, and go from there. And just try and learn as much as you can about dissociation to try and give them effective help. Okay, that's end of part 2. Thank you for listening to me babble on for the past 2 videos, because there is a lot of jump cuts going to be in these videos. Mainly there was just so much information to remember, and I tried having a light on this time, and it's really hard to read with it blinding me. But yeah, that's it for this video, and I'll see you next week.